and welcome to the Dr. Bob Show. We'll be spending most of this show talking about symptoms that occur surrounding menopause. Hot flashes, whew, I just can't get cool enough. Night sweats, drenching night sweats, what caused those? What can we do for those? Changes in personality, irritability, depression that can occur during menopause. My guest is Dr. Kenneth O'Kelley. Dr. O'Kelley is a board-certified OB/GYN doctor, and he'll be answering our questions on symptoms that occur around menopause. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about hardening of the arteries and how they can cause symptoms from the top of your head to the bottom of your toes, and learning to run with asthma, or can running cause asthma? We'll be talking about how to control that. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Kenneth O'Kelley, board-certified OB/GYN doctor, and we're going to be talking about those hot flashes or symptoms that occur around menopause. Kenneth, welcome to the Dr. Bob Show.
Thank you, Bob.
What is menopause?
Well, the menopause has to do with the ovary, and the ovary is where estrogen is produced, and there comes a time when the specialized cells that produce the estrogen in the ovary run out of the capability to do that, and so menopause occurs as a result of that.
So it's when you have low estrogen because of the ovaries got tired out and quit working.
Right.
What is the word perimenopause? I keep seeing that when I'm reading about menopause.
Well, menopause means that by definition, the menstruation has stopped for at least 12 months, but prior to actual menopause, there is probably a 1 to 3 year period where the ovarian function is gradually declining, and that's where we talk about perimenopause.
Are people going to get the same symptoms with perimenopause, or is it going to get worse when, boom, the axe comes down and it is menopause?
Right. Well, I think there's some things that can happen on the way to menopause that are related to the erratic function of the ovary as it is declining. And this may be irregular patterns to the menses, worsening of the premenstrual type symptoms that a woman can have sometimes.
So it gets worse right before menopause, sometimes
It
premenstrual
can.
symptoms.
It varies from patient to patient.
What are the classic symptoms that at menopause women get that bother them so much?
Well, I would have to say mainly hot flashes and then sometimes vaginal dryness or vaginal problems.
So let's talk about hot flashes. What is a hot flash? You know, I'll see a lot of people who, are pulling their clothes out, trying to get some air circulating.
Right.
What is a hot flash? What causes it?
Well, we believe that it has to do with the temperature regulation in the body, and it is sensitive to estrogen, and when estrogen goes away, then it becomes kind of hypersensitive to minimal changes in body temperature, and then it responds in a sort of an overreaction with flushing and blushing and redness and sweating and things like that.
Does the degree of hot flash vary from woman to woman? Do some people not have hot flashes? Does everybody in menopause have them? And can it be mild, moderate, and severe?
It varies from patient to patient. A majority will probably have them to some degree. Some women will experience them, but they won't be significant enough that they feel that they need to be treated, and others, they can be quite severe.
Tell me some stories about quite severe. How much can a hot flash incapacitate somebody?
Well, I think the biggest thing for a lot of women is that they'll happen at night and they'll interrupt their sleep, and then they'll feel terrible the whole next day because they'll be fatigued and sleepy and tired and that sort of thing. And it can, over time, become a real health issue.
When people have hot flashes, how long do they last? How frequent are they?
And again, the frequency varies from patient to patient, but typically each one will last a few minutes.
So 3 or 4 or 5 minutes, and it's pretty severe at that time, and they wish they didn't have them. Will it occur twice an hour, twice a day, 5 times?
It's going to vary, and it's going to depend upon other things that might be triggers. You know, my typical scenario is we get up in the morning, we take a hot shower, we drink a hot cup of coffee or tea, and then we sit down with a blow dryer. Well, I don't, but a woman does, and she's sitting in front of the bathroom mirror having the worst hot flash of the day because of all these things that she's just done that might increase her temperature and trigger a hot flash.
So if you learn to take a lukewarm shower on the cooler side, and if you put the hair dryer on the cool part, would it help relieve symptoms? If you lower the temperature, the ambient temperature, the temperature around, does it help people with that?
I think there are a lot of things that people can do and do to prevent these from coming on, avoiding hot drinks, avoiding hot rooms, avoiding hot showers, you know, all kinds of things like that.
So they can help people. If you throw out that suggestion to a patient that's having hot flashes, do they come back and say, hey, that really worked? Or, it worked a little bit, but I'm still having hot flashes?
Well, you know, we're working on a continuum where the hot flashes may start out mild, and 3 months later, they're back saying, well, that worked for a little while, but now they're worse.
How about night sweats? It's my understanding that these are profuse sweating in the middle of the night.
Well, they can be, and certainly a lot of women are having to get up and change their pajamas and change the bed sheets, and you know, they're freezing out their spouses and things like that with the thermostat and the fans and things like that.
So the two are going together. It's an abnormality in the regulatory system in the actual midbrain is where that is, and so it's estrogen sensitive, no estrogen, hot flashes, night sweats. How about depression, irritability, changes in personality? Does that occur in menopause?
Well, we talked a little bit about in the perimenopause how the erratic behavior can bring on more premenstrual tension type symptoms. But I think a lot of the irritability, depression, things like that occur related to low estrogen, I think goes back again to not sleeping well, not feeling well, and that just impacts on your entire situation.
Do some people like going through menopause? They stop having their periods. They can no longer have the opportunity of getting pregnant, I anticipate, and therefore it would give them more freedom sexually. Do some people feel free when they get menopause, or people say, no, that's a sign I'm getting older?
Well, I think you've got all kinds, and certainly I think we need to look at it as an opportunity to look at the coming years and take stock of our health and that sort of thing. So I think it can be a very positive thing. And I think the idea that I don't need to worry about contraception anymore and I don't have to fool with a period anymore are some of the positives.
And when somebody's going through menopause, does it change their life, or they can be the same old person that they've always been?
Well, I think for the most part, I like to think that people are the same old person they've been. They're just going through a phase.
And how about you? You mentioned vaginal changes, and you mentioned dryness of the vaginal mucosa. Tell me about that and what you can do for it.
Well, just like the temperature regulatory system is sensitive to estrogen, the tissues in the vaginal area are very sensitive to estrogen, and when that declines, then there are changes that occur. Loss of elasticity, loss of the ability to produce secretions that are important for normal vaginal function, and a thinning of the skin that can result in irritation, discomfort, sometimes increased infections, and then problems with sexual relations.
Do estrogen creams help that, or how do you help that without taking pills?
That would be the most common thing that would be used. We would replenish the estrogen that patients are missing, and that frequently is very helpful.
So if somebody wants to get rid of their hot flashes, are there medicines that you can give to make the hot flashes go away?
Oh, certainly, yes.
And that's what we're going to be talking about. What medicines can make those hot flashes go away? You'll want to stay tuned. We're talking with Dr. Kenneth O'Kelley about menopause, the symptoms that occur during menopause. People have night sweats, they have hot flashes, they have sometimes sexual changes, and they're all treatable. So if these are treatable, if somebody comes to you and they're having symptoms around menopause that we've talked about, how do you counsel the patient of what they should do?
Well, part of my time is spent trying to reassure patients that there are treatments available that are safe, because I think women have heard about concerns about dangers of estrogen therapy and that sort of thing. And what we have found is that, particularly in that age group, this can be a very safe treatment for that time period where they're trying to get help through that transition.
So let's say I'm 48 years of age. What's the most common age for menopause?
Probably 51. The range would be maybe 48 to as late as 55.
Let's say I'm a female and I'm 50 and I'm sure I'm going through menopause. I haven't had a period in a year and I'm having hot flashes. And what would you tell me to do about it?
Well, the most common thing that we would talk about is hormone replacement therapy, and estrogen is the main component of that. There are some non-hormonal options that we can think about and talk about, and particularly if patients want to go that way, or maybe they may need to go that way based on their medical history.
So if somebody wants to utilize hormone replacement therapy, what you use, estrogens?
Right, and then we would add to that a progestin or progesterone if they still have their uterus, because we want to counterbalance the effects of estrogen on the lining of the uterus, which can cause it to proliferate or grow.
Okay, so combination medicine if you still have the uterus. If you don't have the uterus, if it's out of there, then you use just estrogens.
We typically just use estrogen alone to treat the menopause symptoms.
Middle dose, low dose, high dose?
Well, a good rule of thumb is probably, in terms of safety, let's use the lowest dose that's effective. And we can kind of decide in general what that's going to be ballpark based on previous experience. And then over time, if we're successful in treating those symptoms, we may want to try to reduce that gradually over time and find what is that minimum effective dose for that patient.
So I'm a female, I'm 50, you placed me on estrogens. How long will it take for the hot flashes to go away?
Well, this transition can vary from patient to patient, but is usually several years. At that point...
Before the hot flashes go away?
No. You'll respond to treatment within probably several weeks.
Okay, so it may take a few days for the estrogen to start taking the hot... So how long do I want to take the estrogens?
How long do we want to stay on it was what I was talking about. Like I said, after a few years, we would probably have a conversation about, can we reduce the dose, see how you do. If we get down to that minimum dose and the patient's still doing well, then I'll ask them, well, what do you think long term? And it becomes an individual decision, pros versus cons, benefits versus risk. But I'd say probably within 3 to 5 to 8 years, a lot of these patients will be able to, if they choose, to come off of the medication.
And if you stop the medicines, what's the chances that the hot flashes come back?
Well, it varies again from patient to patient. Most patients will do well, but we do see that there will be a certain segment of women who just, doesn't matter how long it's been, they seem to continue to have symptoms and they may need treatment longer.
So I'm 50, I've had hot flashes. I don't want to use hormone therapy because there were some family history issues and I'm afraid of what can happen with that. What are some other things that you can do for my hot flashes?
Well, there are some non-prescription things that have been tried and have some effectiveness, I think, for particularly milder symptoms. Some of the herbal remedies have had some benefit, have shown some benefit. And some of the things that we call phytoestrogens or isoflavones like soy and things like that can be helpful.
Do they help?
I tend to find that they are helpful for mild symptoms, but for more moderate or severe symptoms, they're usually not quite enough.
Anything else other than phytoestrogens?
Well, as far as prescription medications that are non-hormonal, we would want to mention the group called SSRIs, or selective serotonin reuptake inhibitors. These have been used traditionally for treating depression, but they've been found in some cases to help reduce hot flashes or night sweats. And then another medication that has been used off-label for this is a drug called gabapentin, which was originally designed to be used for epilepsy, but has been found to help reduce hot flashes in women as
So
well.
we find medicines that were used for some other things that seem to work. Do you think SSRIs are better than gabapentin, or depends on the patient?
I think it kind of depends on the patient.
If somebody just doesn't want to use medicines that make them feel different, and sometimes medicines do, can you help the patient by the type of clothing they wear, by taking cooler showers, by making sure that they're not in the hot atmosphere and not drinking the hot cup of coffee? Does that help later on also?
Certainly, and I think if I try to reassure patients that if they're like most people, they're going to, it might be tough at first, but they're usually going to see a decline in their symptoms over time.
Let's talk about changes in sexual desires, and let's talk about the vaginal mucosa. So if somebody is having a dry, atrophic, it's sort of fading away, what can you do for that if you don't want to give them estrogen tablets? What can you do?
Well, first of all, for some women with minor symptoms, it may just be a little bit of a difference in what they're doing, using a personal lubricant and that sort of thing. There is a product available now called Osphena, which is in another group of sort of estrogen receptor modulators that's not estrogen itself, but acts like estrogen on the estrogen receptors in the vaginal tissue.
So would this be a suppository, or would this be a tablet you take?
It's an oral tablet.
So
it's
an oral
medication.
tablet that's receptive just to the estrogen receptors in the vaginal mucosa.
Correct.
You find that works?
It's relatively new, and I don't have a lot of experience with it yet.
But it's
the
something you
studies
could
suggest that it's certainly something we can try.
Try there. Changes in libido. Do people become more sexually active or less sexually active in menopause?
It could go either way. Again, if someone is not worried about contraception, and they're not worried about their periods or things like that, and they may feel more free about those things. And the vaginal changes are probably the main thing about menopause that may impact on libido. There certainly are hormonal changes going on that can play a role as well. And so we sometimes need to treat related to those symptoms.
Kenneth, your overview of somebody that knows menopause is coming, what do you tell them about life's going to be good, or we can help you along?
Well, again, I try to encourage patients that, particularly when I see my patient come in for her annual exam and she's 47, 48 or whatever, and she doesn't seem to be hitting those symptoms yet, I try to educate them about what to look for, the signs and symptoms, and encourage them to call and come in and let's talk about it when those symptoms occur, not to be afraid of treatment options if they feel like they need treatment, but at the same time, if they're doing okay, this is a natural part of life and they may not need treatment.
Kenneth O'Kelley, you're a great teacher. To me, I really learned a lot about hot flashes, and there are things that we can do to control those. And it can make such a change for people that are having a difficult time with that. Thank you for coming to the Dr. Bob Show.
Thank you.
Great show. You'll want to stay tuned. We're going to be talking about hardening of the arteries and how it affects anything from the brain down to the toes, and exercise and asthma. How do we handle that? Women talk about hot flashes with menopause all the time. They talk about, oh, how terrible it is and how they need to cool themselves off. It appears like it may be something going on in the midbrain that makes the heat regulators change. So we have hot flashes. What can we do about those hot flashes? Well, watch what you wear. Be sure you wear something that's light, that floats well, that you can fan yourself, that you can cool yourself down. Drink plenty of liquids. If the thermostat is too hot, turn the thermostat down. There's a lot of situational things that women can do to cut down on the effects of those hot flashes. Otherwise, know that they're usually not going to last too long. So if you simply use that fan and cool yourself off, that may be all you have to do. But if those hot flashes are interfering with the way you're performing or the way you're sleeping, that's the time to see your doctor. And your doctor can manipulate those hot flashes with medications if you come out to that decision. So know that hot flashes and night sweats, profuse sweating at nighttime, are usually hormonal. They frequently occur at about age 50 in women, and there are medications that you can use to help stop those hot flashes or you won't be so miserable. I want to thank Dr. Kenneth O'Kelley. Wonderful discussion on how to handle menopause. Now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, what happens with hardening of the arteries? What is it and what causes it? Well, we get back to the old cholesterol problem. And it's cholesterol that's deposited into the arteries. Now, when the heart beats, it throws blood out into the arteries. So the arteries are what carry blood to the rest of the body for nourishment. The cholesterol, the LDL, the lousy cholesterol, that LDL, if it gets too high, we know that's the cholesterol that deposits in the arteries. So does it select any specific artery? No, it hits all of them. So we've got hardening of the arteries in our brain if we haven't taken care of our cholesterol. So the arteries that are in the central nervous system, the arteries become hard. They don't give enough blood to the part of the body that needs the most blood, and that's the brain. All the literature really that I look at in people that have Alzheimer's shows that they've got vascular changes in the brain. So be sure that we're working on your cholesterol and your hardening of the arteries. Hardening of the arteries in the coronary arteries around the heart. If those go bad, we can get heart attacks. When we go down into the abdomen, the big vessel, the aorta, the abdominal aorta, if we get hardening of the arteries there, the vessels can get weak and they can balloon out. If we get hardening of the arteries down in the extremities, down in our legs, then we get what we call claudication, not enough blood to handle the muscles when we're walking, when we're running. And so we start getting leg cramps. The same thing is going on in the entire body. We need to start early. Know what our cholesterol is. Eat good foods. Talk to your doctor about your cholesterol. See if you need medicines for your cholesterol. Eat properly and exercise properly. Get your vessels in good shape where they're nice and bouncy and not hard, because you're going to have high blood pressure, heart attacks, strokes, problems from the all the way top of the head to the bottom of the toes. Next question, Dr. Bob. I have an 8-year-old grandson who wheezes with exercise. Well, it's an excellent question, and it's an excellent thing to observe. When people exercise, sometimes they'll have to stop because they're coughing and they have a tightness in their chest. What is happening is they're having exercise-induced asthma. Asthma is a condition where the airway, it's a round tube, where that airway goes into spasm. Well, exercise can actually make the airway go into spasm. It's much worse if the temperature is less than 45 degrees. It's much less if the humidity is low. So if we've got dry, cold air and a tendency toward asthma, then if we exercise longer than 6 minutes usually, we may begin to get cough and wheeze and shortness of breath. Now, elite athletes can get exercise-induced asthma. Well, what do? Jim Ryan, with first 4-minute miler, had asthma, and he had exercise-induced asthma. There's an albuterol inhaler that you can use before you run. Now, the albuterol inhaler begins to work in 5 minutes. It's working at its maximum in 15 minutes, and it's going to last 4 hours. So if you use it before you exercise, it can keep you from having exercise-induced asthma. A lot of times people are afraid to go out and run and exercise because they know it will make them cough and wheeze. Some football teams, as many as 50% of their athletes. Now remember, football players are running in the fall of the year. That's when ragweed that causes allergies can cause problems, make you more susceptible to having allergic asthma and exercise-induced asthma. And the weather gets colder later on in the fall. So exercise-induced asthma is cold, dry air. If we put somebody on a treadmill, drop the temperature below 55, take away humidity, they'll begin to wheeze if they're prone to have that. Athletes that are exercising in high altitudes, dry, cold air, without having asthma, they can actually do injury to the lungs that will make them start having exercise-induced asthma. There is treatment. If you've got it, talk to your doctor. That's all the time that we have for this show. It's been a great one to me. I hope you've enjoyed it also. Remember, we've got to be exercising on a regular basis. Get those tennis shoes out of your closet. Just walk out that front door and start walking. Do it every day. Walk 30, 40, 60 minutes every day, and you'll find that it will reduce stress. You'll feel better. It will help us lose weight. Eat proper. We sometimes just don't eat well. We're marketed to eat, and we're marketed to eat foods that are not good. So eat less food and eat better foods, and you'll find that with exercise will help you lose weight. Get 8 hours of great sleep. Remember, that sleep, and now we think it's 7.5 hours will make you feel better. And most of all, what is it we like in the Dr. Bob Show? Well, giggle and laugh and see how healthy you're going to be.